Post-traumatic stress disorder, also known as PTSD, is defined as a condition of persistent mental and emotional stress occurring as a result of injury or severe psychological shock. The most common cases of PTSD are a result of combat in war. Veterans are the largest group of people who are suffering from this condition. Many veterans feel as if they are the only ones who came out of war with PTSD. They often feel alone and believe no one understands their condition.
I felt like I was the only one in the whole world that came out of the war with something wrong with my head. I never even talked to my own wife about the war. I didn't think it was a good thing to bring up. We had separate beds because I had bad nightmares and came flying off the bed, screaming my mother's name out. I couldn't tell anybody. I thought every bartender in Brooklyn was my psychiatrist.
Veterans believe that bottling up their thoughts will make their condition better because they aren't bringing up the war or the horrid events that triggered their post-traumatic stress. But instead, this ends up causing loneliness and built-up anger.
Someone come back, they feel worthless. They have anger issues because they're upset over, what happened. It depends on the trauma. And some of them become very suicidal.
On average, 22 veterans will commit suicide every single day. The reason is mostly moral injury. They can't kill and face death and return unchanged to a world in which they are expected to refrain from all violence. It is very challenging for them to adapt to the civilian lifestyle. PTSD does not only affect the person who has it, but it also affects intermediate family and friends. Family members may feel hurt, alienated, frustrated, or discouraged if their loved one loses interest in family or intimate activities and is easily angered or emotionally isolated and detached.
It really affects the family. In fact, they have what's called secondary trauma. Sometimes spouse and children get it just from being around a person like that because of what they're going through.
Family members who are caring for their loved one may lose patience if they do not understand the disease, or they may adopt some of the same symptoms if they do not know how to help their loved one recover. So far, there isn't a cure for PTSD, but there are a few treatments that help, such as cognitive behavioral therapy, medical marijuana, and battle mind training. Medical marijuana has been used to treat diseases such as cancer, Alzheimer's disease, and glaucoma. Recently, it has been also able to treat PTSD. By aiding in memory extinction, medical marijuana could help patients with PTSD reduce their association between stimuli, such as loud noises or stress, and the traumatic situations in their past. Medical marijuana can help soothe veterans when they're having a flashback or a panic attack, which helps them remain calm when they get overwhelmed. Another treatment for PTSD can be battle mind training.
In my group, we offer what's called battle mind training. It basically takes the life skills that they learned for surviving while in the military and learning how to apply those outside the military. And for some that works, but nothing's 100%.
Doctors and the U.S. Department of Veteran Affairs are working very hard to find a cure for those with PTSD. Not all wounds from war are visible. With post-traumatic stress disorder, it is only a psychological scar which cannot be seen by anyone else. Post-traumatic stress disorder is a real mental illness.